My name is Carly Calloway. This is my Dixie ID, and this is going to be my final physical assessment video. So today I'm going to be assessing a stroke patient. This is Connor. He's a 24-year-old male, and he had a right hemorrhagic stroke after a head injury. He has no significant medical history. He did have a craniotomy procedure to remove the bleed, and he also had an EVD drain in place to decrease pressure on the brain. That drain has since been removed. So today we'll be assessing the neuro, musculoskeletal, and urinary system of this patient. So for his neuro exam, I'm going to be using a specialized NIH stroke scale to assess. So the first part of this assessment is level of consciousness. So Connor, can you tell me your full name and what happened to you?
My name is Connor Calloway, and I hit my head.
Perfect, okay. And can you tell me the correct month and age?
It is April, and I am 24.
Perfect, okay. I'm going to have you close your eyes and make a fist for me. Perfect, and this left arm is paralyzed, so he was unable to do it on that side. So we got both of those correct. Okay, so now I'm going to have you follow my finger, okay, with your eyes. Good, 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 good. He's got normal eye movements. Now I'm just going to test your vision, okay? So I'm going to have you look straight at my nose. I'm going to put these over here, and I want you to tell me how many fingers I put up.
2,
Okay.
3.
Good, good. Okay, I'm just going to look at your eyes real quick with the light as well. Can you look at me? Okay. Okay, so his pupils are 4 millimeters in diameter and are reactive and equal. Okay, so now I'm just going to have you smile and raise your eyebrows. Good, he's got normal facial symmetry. And now I'm going to check drifts on all extremities. So for the left arm, I'm going to start. Just going to see if you can hold this arm up at all. Okay, and the right arm, I'm going to have you hold it up just like this. Good, I'm going to have you hold that for 10 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Good. Okay, and on the left leg, I'm going to have you see if you can hold it up for 5 seconds, okay? 1, 2, 3, 4, good. Okay, and then on the right leg, hold it up for 5 seconds. 1, 2, 3, 4, 5, good. Okay, I'm going to have you take your right leg, take the heel and put it on your shin, and I want you to drag it down to the end and back up for me. Perfect. Okay, can you do the same with your left leg? I'll help you. Okay. Okay, let's try one more time. Okay, so he's got a drift on the left lower extremity. Okay, so now I'm going to be testing limb ataxia. So with your right arm, I just want you to touch my finger and then touch your nose. Good. Perfect. No ataxia. Sensation, I'm going to be just testing with a pen, kind of a sharp object. Okay, so I'm going to have you close your eyes for me. Which side am I touching?
Touching my right side.
Okay, what about now?
Left.
Okay, can you feel me touching both sides?
The left is not as much.
Okay, the left is a little weaker. Okay, what about now? Which side?
I'm touching my right.
Okay,
Left.
okay, what about now?
Both, but left is weaker.
Okay, okay. What about now?
Right.
Okay,
Left.
okay. What about now?
Yeah, both, but left is weaker.
Okay, so the left side is definitely weaker, but you can definitely feel me touching you on the left side.
Yes.
Okay, perfect. Okay, so now I'm going to show you some pictures, if that's okay. Okay, so I'm going to be showing him this picture first. Can you tell me what's going on in this picture?
The mom is washing the dishes while the water's overflowing. The kids are getting cookies from the cookie jar, and the boy is falling over on the chair.
Correct. Perfect. Okay. And now I'm going to have him read these phrases. Okay. Can you read those for me?
You know who, down to earth, I got home from work, near the table in the dining room. They heard him speaking on the radio last night.
Perfect. He got all those correct. And then I'm showing him this picture now. Can you tell me what each of those items are?
A glove, a key, cactus, a chair, a feather, and a hammock.
Awesome. Okay, so he's got no presence of aphasia. I'm now going to be testing for dysarthria. So I'm showing him these words. Can you read those words for me?
Mama, tip top, 50-50, thanks, Huckleberry, baseball player.
Perfect. And he has no presence of dysarthria as well. Okay, so now I'm going to be testing his extinction. So can you close your eyes again for me? Good. I just want you to tell me which side I'm touching.
Left.
Okay.
Both.
Okay.
Right. Both. Left.
Okay.
Right. Both.
Good. Okay, you can open your eyes now. I want you to just look straight at my nose. Okay. I want you to tell me which hand moves, okay? Good. 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 And he's got normal extinction. Perfect. And so now we're going to move on with the musculoskeletal. So I'm going to have you shrug your shoulders against my fingers. Okay, go ahead. Okay, so now movement on the left side. Okay, can you squeeze my fingers? Good. He had normal strength on the right side and no movement on the left. Perfect. Can you wiggle your toes? Perfect. Can you push on my hands? Good. What about pull me towards you? Good. Perfect. So right side is normal and the left side is significantly weaker. And now I'm just going to be testing your joints. So I want you to look at me. Can you move your head forwards and backwards? Good. What about side to side? Perfect. Okay, with that right arm, can you hold it out in front of you? Good. Can you wiggle your wrist around? Good. What about bend your arm in? Good. Hold your arm up to the side and down. Perfect. Okay, so now with your right leg, I want you to bring your knee to your chest. Awesome. And then hold it out in front of you, straight. Can you wiggle your ankle? Perfect. Okay, can you do the same thing with your left leg? Okay. Okay, I'm going to hold it out for you. And can you move your ankle in all directions? Okay, perfect. Okay, so pretty much normal range of motion in all extremities, except for the paralyzed extremity here. He has definitely weaker movement on the left side, but can move in all directions on the left side. So now I'm just going to ask you a couple questions about your urinary system. So did you have any issues with urinating prior to your stroke?
No issues at all.
Okay, so since your stroke, have you had any trouble with being continent or impaired urge sensation?
Yeah, sometimes I pee a little bit and I don't realize that I need to go.
Okay, but most of the time are you continent?
Yes.
Okay, so sometimes you just have a hard time sensing that you need to go.
Exactly.
Okay, it's a sensation issue. Okay. Do you have any pain or difficulty while urinating?
No.
Okay. And how much do you generally urinate in a 24-hour period, would you say?
Probably about a liter or so.
Okay. Okay, and now I'm just going to palpate your belly, if that's okay. Okay, any pain? Okay. So his belly feels soft, there's no tenderness, and doesn't feel like there's any issues with retention or anything. So, do you have any questions for me, Connor?
No.
Okay, perfect. Thank you.